Hey everyone, my name is Johnny Lawrence, and I want to introduce you to something a little bit different. I want to introduce you to the Strength Shed Sessions.
Yeah.
Hi, my name is Johnny Lawrence, and welcome to another episode of the Strength Shed Sessions. Today is a very special episode. You'll understand why shortly. I'm going to be a bit self-indulgent and talk about myself, but I'm sure you'll be all right with that. I'm here with a very special chap. His name's Dr. Martin Kinsella, and he's going to tell you a bit about himself, on your mind.
Yeah, thank you very much, Johnny. Yeah, so I'm a doctor. I'm dually qualified, and I'm a doctor and dentist in part of my background, and I've been practicing. Started out in aesthetic medicine for about 15, 16 years.
What's that?
So aesthetic medicine is basically cosmetic, surgical, medical, injectable treatments. Basically all treatments to make people look more youthful, more beautiful, anti-aging kind of treatments.
Yeah.
And because of that, I was doing all these treatments, and I've been doing it for a long time and making people like look good on the outside. So about 9-10 years ago, I got fascinated with trying to make people look maybe better on the inside. I started to realize that beauty wasn't just skin deep. So, and a lot of my patients who were always coming into practice were always saying, you know, they were spending all this money on Botox injections and dermal fillers, but they always said that they felt rubbish. They felt tired. They felt like they felt old. Yeah. And a lot of them, maybe women or even men in the 40s and 50s would say, oh, I know I'm hormonal. And I used to just always ring bells with me. And I used to think hormones, something like that. And then, so about 10 years ago, I had some patients. It was through my group of patients who were talking about vitamins, and they were asking me about intravenous vitamins, you know, the drips where they had the vitamins, and, you know, things in the blood and stuff. And that's where it sort of piqued my interest with hormones. So I started doing hormone replacement, and then I've been into bioidentical anti-aging hormone replacement for about 9 years. And then I've been doing, from that, it's kind of led on to other things. So nutrition, supplementation. So I can really try to offer the whole package really of sort of internal functional medicine. And I do it for men and women, and I do it for people with different ranges of symptoms. It might be that they've got, if it's a woman, it might be menopausal. It might be for men who've got certain types of symptoms and are not getting very far with the doctors. Yeah. Or they're just not feeling great and don't really understand what's going on. And it might just be for some people who are in the gym, they want better performance, they want to look better, or they want to stay looking and feeling young, giving them optimal quality of life.
I mean, you've got quite a few practices up and down the country, out the country actually, isn't it?
Yeah. So
you work in practices? Yeah.
So I've got two of my own practices in the UK. One in South Manchester in Cheshire, one in Yorkshire just outside Leeds, and I have a third clinic in Palma in Mallorca. Which is just aesthetics. I don't do any functional medicine there. All my practices.
I bet that's a shame. I bet you hate going out there, right?
No, I love it. No, it's all right. You have to be careful. So, no, I absolutely, I do love it. I've got great. I'm very, very lucky. I've got fabulous clients. But different. What I like is I have different types of clientele in different places. Yeah. So in Palma, for example, I see a lot of. I'll see a lot of German and Scandinavian clients along with the English. Whereas in London, I'll see a completely international mix. You know, completely different, very multicultural, different, and then that might be different type of client type to what I see in South Manchester.
That must be quite interesting for you. As somebody who's passionate about this, you get to get that variation.
Yeah, I do.
That's great.
So yeah, and as I said, I do two other clinics, which are my own. I hold a clinic for 2 days in London every month, and I'm down in Cornwall for 2 days a month. So I usually do those back to back. But they're not mine. They're just me traveling, and that's how we've come to cross paths.
That's right. I mean, as I said, I'm going to be a bit self-indulgent, and I'm going to explain how I've met Martin. Quite some years ago, I started to feel a little bit fatigued, and it slowly got a bit worse. And as always with men, their wives encourage them to go to the doctors. So I go to the doctors and I explain I'm feeling fatigued. They said it was probably stress, and they give me some advice, and I accepted that and went on my way. But then it got worse. And when I say fatigue, I mean I would exercise in a gym, and say I was training my legs on a Monday. The following Monday, I would still be aching. When I woke up in the morning, I'd feel like I hadn't slept. My mood started to change, and for people that have supported me and watched this show, they know that I'm quite a high energy, upbeat person, and very positive. And a lot of the time I was struggling, and my body was letting me down. It wasn't giving me the energy I needed to perform at the level I like to. So I knew something was wrong, very, very wrong. And I went back to the doctor, and he did every test conceivable, really. I was in the hospital many times. They took too much blood, in my opinion. And they tested me, and they told me I was fine. Not just fine, they said that you're really fit and healthy. And then we went down, and let me just say, my doctors were brilliant. They did what they were able to do. But I knew that there was something wrong, and I could feel it. And I started to feel like I was going a bit crazy, if I'm honest, because, I know how I feel, but yet they're testing me, they're testing everything. They're testing all my functions, all my organs, everything conceivable, honestly. They did everything, and they couldn't work out what was going on. I've been doing some reading, and I'd spoken to my coach, and we had come to the conclusion that there's potentially, being 40, even though I wasn't 40 at the time, and it could be my age, my testosterone. I was looking into places in London and all sorts of different ways I could get it tested and checked. And eventually my wife crossed paths with Martin and suggested that we meet, and I went to his practice and we had a discussion, didn't we? And we spoke about the multiple options, gut health and testosterone. Yeah. And then Martin suggested that I get tested, and you took my blood, and what were the results?
Yeah, I mean, just to sort of recap on what you've said, I mean, this is something that's quite common. We're seeing this a lot with men, and as you said, a lot of symptoms that are indicative of low testosterone. You so it's talking about the sort of this chronic fatigue, sort of low mood. You think that you felt it was poor recovery. Your body wasn't recovering. Your body was changing. You weren't being able to maintain muscle mass as easily, and less receptive to training. These are all hallmark symptoms. The other thing which I always look for when I'm looking at sort of testosterone levels when I'm talking to patients, because blood tests are important, and we'll talk about it in a minute. But the key really is always to talk to the person. You're not treating a blood test. You're treating the person, and what they're telling you is always is what will make the hairs on the back of my neck stand up when I think I'm onto something. Yeah. And I listened to the patient. And when I remember when we spoke quite clearly, some of the things you were telling me. And it's quite easy sometimes to brush people off, and especially at 40, sometimes with low testosterone, we might expect to see that sort of past the 40 years or mid 40s. So 40 is still fairly young. Thanks. So a lot of people, but a lot of people sort of in the 30s with those kind of symptoms, usually it's quite easy to dismiss as they're stressed and things, and stress will cause those kind of similar kind of symptoms. But what I always look for is when you've got someone who's particularly active or particularly ambitious and they've lost that drive, or a classic sign is when they, for example, if they've got a hobby that they love to do, and now they're not interested in it. It's like disinterest. So they're not interested in doing the things that they love. They've lost their ambition. They've lost the drive. They've got this sort of lethargy, this just a lack of excitement with the world. Coupled with those physical symptoms, the poor concentration, the low muscle mass, the increasing body fat, the possibly low sex drive, and these kind of things. And you've got all the recipe for you've got all the signs that you need to look at the hormone profile, and you need to look at it in depth. So we did a blood test on you. We did a comprehensive blood panel. I always check basic bloods. We did all your blood count. We looked at your liver function, your kidney function, everything. Your biochemistry was all spot on. We looked at your cholesterol. Cholesterol is really interesting because cholesterol levels and hormone imbalances are really closely linked. That's quite a big topic. We'll talk about it another time. We'll be here a while. But we look at everything, thyroid glands, we look at your stress hormones. But one thing that stood out, which was, and it's sometimes quite, it's not, I can't think of the word now, but I'm relieving. I was quite relieved when I saw your bloods because everything looked great except the testosterone. It was low.
Yeah. I mean,
do you remember the level?
Just for collaborate. I give Martin permission to discuss this on camera, so you don't worry about what you say. I remember you said it was 5, and I don't know what measurement that is.
Yeah, so testosterone levels in men range from the normal range is from 9 to 30. That's how we measure it in the UK.
And what age does that cover?
That covers all ages. So that covers anything from an 18-year-old guy up to a 90-year-old man.
It's crazy.
So
right?
the normal range is a big range, and you can fluctuate a lot. So you could be at, let's say your level was at 9, and my level was at 30. Yeah, which it's not, but if it was,
it's not a competition.
It was. I'm not. This is hypothetical. So if it was, I could have 3 times more testosterone than you, but we're still both classed as the normal bracket.
Yeah,
so
that's crazy.
There's something fundamentally wrong there. Plus, my level might fall in the normal range. But what was it like? But what was it like 5 years ago? We don't know. We are moving targets. Everything's always changing. So a normal range of blood tests aren't particularly helpful, or they're not diagnostic. When I say diagnostic, they don't really help us make a decision to treat someone. What we want to look at is optimal ranges. Now, for you, it was quite straightforward because you actually fell below that normal range. Yeah. So there was clearly a deficiency in the testosterone. And that's what we attributed causing your symptoms to.
I mean, I can't describe the feeling of relief I had. I felt like I was going crazy because I felt terrible, and I felt all the things that Martin's described and I described, and I was being told I was fine. As a matter of fact, they were suggesting stress. They were potentially talking about antidepressants, which just didn't make sense to me, and that's why I had to look towards different ways of addressing it. Really.
Well, like I said, I mean, things like stress, obviously we have stress hormones like cortisol, and when they start to be overinflated and they're rising and they're too high and things like that, they can have similar effects. So it can be masked. So sometimes people think they've got low testosterone and actually they've got really high cortisol levels. So it can cause that. And so with someone at your age, as I said, at 40, I was thinking, well, it could be one or the other. I wasn't really sure at the time, but we wanted to check both. But it's really interesting. You are sort of, it's like what made me really think it was a testosterone, if anything, was what you were telling me, because it was classic. And this thing about, you're saying about your wife was making you come to see the doctor.
Yeah.
This is really, really common. A lot of guys in their sort of mid to late 50s, you think about it, they end up going to see the GP. A lot of the time they go to the GP because they're not actually very well. They're not feeling very good. Like I said, they've got the tiredness, getting overweight. They've got low sex drive. They've got low mood. They've lost their ambition, and they've got poor concentration. Some even have things like night sweats and things. Yeah. They go to the GP, and actually, what's happened is their testosterone levels or their hormones have been declining for years. This isn't something that just happened overnight. This has been going on for 20 years beforehand. So from your mid-30s onwards, your testosterone levels are anabolic hormones. Anabolic hormones are things that help build us up. They build muscle, they burn fat, they help us recover our tissue, they give us sex drive, they give us vitality, they give good quality of life. There are life force as a man, there are life force hormones. These things slowly start to decline. And things like our estrogen levels, and which too high an estrogen level is not good for us, and our cortisol levels start to go up. And a lot of the time, when they have a medical health check, they find that they might have high blood pressure, they've got high cholesterol, and so they commonly get prescribed by the GP. They go in with these symptoms. They commonly get prescribed blood pressure medications, statins for the cholesterol, antidepressants, Viagra for the erectile dysfunction. Yeah. And actually, what you're doing there is we're putting a Band-Aid on a big wound, which needs to be healed by treating the root cause of the problem. Yeah. And that's the problem. And I'm not suggesting there's no place for blood pressure medications or statins. They do have their role for the right people. But what we need to start to look at the root fundamental causes. Yeah. And that always is a combination usually of hormones and coupled with nutrition, lifestyle, supplement, that kind of thing.
So that was my next question really is I found myself with low testosterone. I have a belief, and I don't know if I've even said this to you, but it was some time ago, about 8 years ago, I had to have a vasectomy, and that was the choice that I made over my wife and all that sort of stuff. And I worry that's what's like contributed to it. But I mean, what other things can cause that?
Well, I mean, there have been links to things like vasectomies and things because what can happen sometimes is the body can sometimes make some antibodies, so that can suppress testosterone function. Obviously, other things like testicular trauma to testicles is something, or kind of...
That would go under testicular trauma, wouldn't it?
Yeah, well, slightly, yeah. So operation like that. Yeah. But also, pathologies like testicular cancers and these kind of things can do that. But then also things like the use of anabolic steroids. So the thing is, what people don't understand is your body naturally is fine-tuned to produce these hormones. Now, when you take testosterone, you effectively the body stops making its own. It's like any natural hormone in the body. When you give it from the outside, the body has a feedback system. It registers that the levels are high and shuts its own production down. So hypothetically, if I was trying to increase your testosterone from 50 to 100, hypothetical, not their particular ranges, or let's say your range. So let's say I'm trying to increase your level from 5 and I want to get it to 30. I don't give you that 25, that difference. I give you the 30 and your body stops making the 5. Right. Now that's fine for you because your body's only making the 5. That 5's not good enough. It's probably never going to be good enough. So you don't have anything to lose. The problem is if your testosterone levels are at 15 or 20 or 25, and you then start taking anabolic steroids to pump your levels up to usually far beyond normal physiological limits. When I say physiological, I mean that would be natural for the human body. So if you're trying to use it just to make big gains in the gym, to put muscle on, to get it for a competition, you'll be artificially raising the upper limit of the testosterone. So you're then taking a normal testosterone level, and what you're then doing is increasing it by giving a larger amount, and you're shutting down your own natural testosterone production because your body's registering high levels because you're maybe injecting it or whatever, and the testicles are shut down effectively by your brain. So, and if that happens for a long period of time, when you then come off the testosterone, your testicles can't make the testosterone. Your body can't make the testosterone levels like it did. So you actually end up with a reduced testosterone level at the end.
So explain that, because
does that make sense?
Yeah, no, it does. But going back to basics even further, you explained that the testicles creates the testosterone. Can you explain that? Just how that, not detailed, but
so basically your brain produces certain types of what we call stimulating hormones, which tell the testicles to make the testosterone. Right. So, and then as the testosterone levels rise, the brain monitors the levels of testosterone and reduces the signal to the testicles accordingly. We call it a negative feedback loop. And it's quite a sensitive balance. And if you artificially interfere with that, then you can damage that feedback mechanism. So for example, when you take the high levels, your body registers it, shuts down the testicles. When you stop taking it, that shutdown, that feedback loop has been damaged. So a lot of people who come off testosterone find that they might have long-term low testosterone issues and have to then go and seek advices from specialists and doctors.
I just felt that was important because there could be people out there who are contemplating that decision, and I think that information is useful towards making that decision. So thank you for that.
I think, like you said, I think it's important to, before you even maybe look at doing that, is having a test and also, be taking care not to put your levels to an unnaturally high level.
Yeah. I mean, that makes a lot of sense. Are there lifestyle changes that you can implement to improve your chances of not getting low testosterone? I mean, I know there's lots of
definitely. So I mean, there are certain types of supplements. We can talk about supplements. I think in terms of just purely lifestyle, your diet's huge in your hormones. I mean, maintaining good gut health and stuff like that. And obviously, some foods are more estrogenic, so they can raise estrogen and lower testosterone. Things, obviously spiking insulin all the time. So so in your body, you've got other hormones, things like insulin that basically when you have sugar, your insulin levels raise, and that tells your body to take the sugar out of the blood and store it as fat effectively. It's not a simplified way.
No,
but
thank you.
So insulin, high levels of insulin is can be quite a bad thing. And insulin's best friend in its body is cortisol. So they run around the body together as mates, and they hate testosterone. So when testosterone levels are high, that keeps cortisol and insulin at bay. But when cortisol and insulin are raised, usually by excess sugar in the diet, stress, lifestyle factors and things like that, then that will suppress testosterone. So exercise, the type of exercise you do is extremely important for your testosterone levels. So that's why things like a lot of endurance, low intensity exercise is potentially quite bad for your anabolic hormones like testosterone, because things like that will raise cortisol. Right. Okay, and that will suppress, and it will because you're putting the body under chronic stress. So acute stress, short periods of good stress are great for the body. Your things like your DHEA levels, which is like an adrenal hormone, and your testosterone, they both raise in response to that, and they help build muscle, burn fat, repair the body. When that stress becomes chronic, things like cortisol levels then start to go higher and suppress the anabolic hormones. So your body becomes catabolic. So for example, it's one of my bugbears and things like that, but you know this, I always say, if you're worried about your testosterone, don't be doing long distance cycling. Yeah. Sat on a saddle for long distances. I'm not suggesting that people put the bikes down, but or if look at the difference in physique between a marathon runner and a 100-meter sprinter.
Yeah.
They look different.
Yeah, right.
Now I'm taking two extremes there.
Yeah, but to make an example,
the 100-meter sprinter is doing very short bursts of intense activity, using a lot of fast twitch muscle fibers. They're anabolically loaded, whereas the long distance person, they look catabolic. They're much lower muscle mass. They look more drawn. So the type of exercise. So I always say to men when they get into the 30s, especially in the 40s, they should be definitely doing resistance training. And that's been proven as well. Three times a week of resistance weights training has been proven to be more effective than doing low intensity cardio for cardiovascular system, for anti-aging, just pure anti-aging, for your neurodegenerative, to protect you from neurodegenerative diseases, and obviously your musculoskeletal system. Doing big and for me, I always recommend big compound movements. You can't beat things like your deadlifts and your squats. Big compound movements. What that will do, and also your legs are a huge muscle. So people go to the gym and it's dead easy to go and do the mirror muscles, isn't it? They're doing the pecs and the biceps and things. But if you want to really boost your testosterone levels and actually have a better overall effect on your whole body, then train your legs, because the legs are the big muscle. They've got all the big fast twitch fibers. When you train those, you're going to stimulate testosterone release. You're going to stimulate growth hormone release, and that's going to have a much bigger impact on any training you do for any of your body. Yeah. When you do a deadlift, you're using 80% of the muscles in your body.
Feels like it too.
Yeah, but there's a reason why, and there's a if you go and do deadlifts. I've gone in the gym before and I'll do 45 minutes on deadlifts. I don't feel pumped. I feel nervously shook up. Yeah. There's something in the core that I feel disorientated. Yeah. It's because it's been a short, sharp shock. I can't say the word. Short, sharp shock to my nervous system. But the stimulation of hormones from that afterwards is good. So type of exo. I'll stop going on now because I'm rambling on. But the type of exercise you do. Weight training, large compound movements, and high intensity exercises.
So intervals sort of thing,
yeah. And then obviously, your diet. You want to be having a good diet. You're maintaining good amounts of protein on the right types of supplements. We've talked quite a bit about supplements in the past.
Today.
Things. We do that. There's certain things as well, like your zinc and magnesium is very, very good. Magnesium is essential for your muscle recovery. Zinc is also what we call it's an anti-estrogen. It has anti-estrogenic properties. Mm-hmm. So when your testosterone levels are high, if you've got too high a level of testosterone, for example, or for example if you're on testosterone replacement, then what you want to do is taking zinc helps keep your testosterone as testosterone. What your body tries to do sometimes is turn it into estrogen, which is not good.
Okay. And sort of, are there any foods, because I know you mentioned, you asked me a whole bunch of questions, do I drink and all that sort of stuff, and you mentioned ale being bad, and there was a few other...
Yeah, I always say like sticking off type foods like things that have got a lot of yeast in them and things, quite estrogenic stuff. So beer is not a good one. White wine is particularly bad for you. So they're in your alcohol things. Obviously, lots of stuff that has a lot of gluten in it and things like that. I'm a sort of gluten-free fan. I'm a dairy-free fan. To a degree,
You've convinced me, for sure.
Definitely. Well,
what I like about you is that, you hear this all the time. People say, go gluten-free, go dairy-free, but they don't have an explanation why.
Yeah.
And you give me more than enough information to understand why. So, you say gluten-free, dairy-free. Why would that be a good idea?
Well, the thing is with gluten, and this goes back to, this is like this is a big topic in itself, but quite simply put, gluten basically is a food that really our gut is not very well designed to digest.
Right.
And not only that, it contains compounds that is very commonly recognised by the body as a sort of something that the body needs to attack and will make antibodies to. So what it does is it confuses the immune system. So the gut is a tube basically. All that your gut is a tube. It runs from your mouth to your back passage, and it's got two functions. And both functions are very important. People just think, well, it's for you to absorb your food and take the nutrition from your food.
Yeah.
But it has a second function, and the second function is just as, if not more important than the first. Obviously getting nutrients from your food is important, but the second one's equally important. That is, your gut needs to protect you from the outside world. Things can't just come across your gut wall. So 70% of your immune system is in your gut. It's there, it's lining the gut. It's like the policing the gut.
Nice.
Okay?
Yeah.
Right? So what happens is when we have a poor diet, and that again, diet's a huge topic of conversation, but there are certain things in diet, and gluten is an offending agent. When I say gluten, we're talking about anything containing wheat, which is a lot of different foods, lots of cereals, bread, pasta, all got gluten. Yeah. Lots of sauces have got glutens in them and stuff. But a lot of a big consumption of gluten, what that will do is it triggers an immune response in the gut. The gut doesn't like it. And when you get an immune response, you get inflammation in the gut. When the gut's inflamed, actually, it's a vicious cycle, because the gut, it becomes more permeable. Some people call it leaky gut. A lot of doctors don't like the term leaky gut, but they call it increased permeability. Same thing. And what happens? Because some doctors say leaky gut doesn't exist. Well, it does exist, but but the same doctors will tell you that there is such a thing called intestinal permeability, which it's exactly the same language. Yeah, exactly. So leaky gut, I call it leaky gut. It's a lot easier. Yeah. So your gut leaks into your body. Right. That's bad.
Yeah.
That's really bad.
Doesn't sound good.
Something that's in your gut, that shouldn't leak into your body without the body naturally taking its carrier and bringing it across. And we have good bacteria and we have bad bacteria lining this gut as well. And that complicates the problem. So if you've got a load of if the good bacteria, great, they help us break our food down so that we can transport them easily across. The bad bacteria do the opposite. What they do is they actually grab lots of things that we shouldn't and actually help push them into the body more. So the immune system starts to react to these antibodies in the wheat. The problem then is the body then will get confused because the immune system will get confused because it's making antibodies to this, which can be quite similar to other parts of the body. So it can cause this is where we start to get autoimmune conditions because the immune system is being confused with antibodies. It shouldn't have to make antibodies to it. It's recognizing it as foreign. And that's why a lot of people, when they eat a lot of gluten, they get intestinal symptoms, but they're not on top of that. They can start to get skin conditions, or they might find that their joints ache more, or they might find that their mood gets lower. Wow. So it's an in all one big interconnected organ. So I don't think gluten generally, we've heard of celiacs, celiac. Yep. So that is really where you are completely gluten intolerant to the point where you've got intestinal breakdown of the intestinal wall.
Yeah.
So it's very serious. But just because you don't have celiac disease doesn't mean that you don't have gluten intolerance. It's a big spectrum, the shades of grey.
Well, the word intolerance suggests that, doesn't it?
So at least 30, probably more like 40, 50% of the population are quite moderately gluten intolerant. And there'll be a lot of people who, on top of that have got mild gluten intolerance. So I generally think that gluten is best avoided.
So if we bring it back into the testosterone link, you know, we're talking about anything with wheat is not gonna help that situation. So gluten.
Yeah, I think when you're looking at hormone profiles, and what I'm not doing is I'm not linking gluten intolerance here to low testosterone.
Yeah.
What I'm saying is that you have to treat the body holistically. And what we need to do is we need to look at if there's a serious hormone imbalance. The reason for that hormone imbalance could be a multitude of things. It could just be that's genetically, that's the program to do that.
Yeah.
But it could be a culmination of lifestyle, which is what you're eating, maybe deficiencies in certain nutrients. It could be in food intolerances. It could be a culmination of these things. And you know, long distance exercise, the wrong types of exercise that have accelerated exactly. Well, I know you won't catch me because I'll be sprinting, but over short periods. So sure, I only do. I've run very fast, but not for a very long time.
Yeah.
So. It's a culmination of the factors. So you have to take into account the nutrition side of things. So I do think gluten-free, I encourage my patients to come off a lot of dairy products, especially sort of, cow's milk. I mean, it's just highly unnatural. For me, I just think it's crazy as a human that we would want to drink, a calf's milk from a cow.
Yeah,
it's not designed for humans.
When you put it like that,
it's baby growth hormone for calves. Yeah. That's what it is.
Wow.
The cows produce it for the calves to grow. It's not designed for an adult human, so it's not a natural substance. So I think a lot of dairy products can cause. We see lots of problems with that. We see a lot of skin conditions with that. We see worsening hormonal problems with women. So I think that they're all contributing factors.
It's amazing to me because we're talking about testosterone, but so many things you're mentioning could be easily solved with diet changes. However, people are getting medication. And then that medication, as every medication does, comes with side effects. And before you know it, you're taking something else,
Yeah, I mean, I think, it's a fine line. I think that what we need to do, as I said, is, and I'll come back to this, men with low testosterone commonly get misdiagnosed. Yeah. Or it doesn't get picked up. The testosterone levels aren't tested, or if they are tested, they're classed as normal. And we're missing the one of the key fundamental causes of some of these problems. I'm not suggesting that everyone puts down their blood pressure medications or their statins. No. But what I am suggesting is that we need to be looking for that, and it is putting the Band-Aid on the situation. So as I said, with something like testosterone, all those symptoms that are linked to it, we end up having maybe blood pressure medications or statins and all those sorts of things. And the problem is with medications is when you do start, you then tend to need to stay on them. Yeah. So a lot of people say, well, food is medicine. I think there's a lot of truth in that. I think that they can both work hand in hand. Some pharmacological agents, some blood pressure medications are fantastic medications. They have fantastic regenerative properties on our blood vessels and actually are proven to help people to live longer. And some people genetically have problems with the way they metabolize certain things or the way their receptors work. And so these medications are very, very good for people like that, or if they're in a state of serious illness to start with. But we must start to look at our nutrition and our supplementation, because that is where it all starts. It
makes me happy to hear you say that. It really does, because I say that a lot.
Yeah, well, it's true. Yeah. It is true. I mean, you are what you eat.
Yeah.
And so many, I mean, you talk about in terms of things that can be improved, but pretty much most chronic diseases can be influenced massively by our diet. So many, I come back to this all the time about autoimmune conditions. Autoimmune conditions always link back to your gut health. Autoimmune conditions such as inflammatory bowel disease, rheumatoid arthritis, multiple sclerosis, psoriasis, all these things. This is where your body is attacking its own system. Underactive thyroid can be an autoimmune condition, and it's because the body's immune system is recognizing those cells of whatever part of the organ it is, whether it's the thyroid cells or whether it's the neurons in the brain, or if it's the lining of the gut, as a sort of alien cell to the body. And that's because it's been confused. Right. And that's because it's being flared up by things that are coming across from the gut. So controlling gut health, getting your gut, healing your gut, will have a very positive impact on all the autoimmune conditions.
So bringing it back to testosterone. So I obviously work out, use weights, know what I'm doing. Like to think my diet's good, although I'm questioning it in this moment. But and I find myself with low testosterone. So we have to go to doing something about that. So we went through the options. What are the options for that?
Okay, so it depends on a couple of things. I always ask them if, depending on their age, if they're planning on having any children.
Right.
So the links between does taking testosterone reduce your fertility? The link is not particularly clear, but if you go to when couples go to infertility clinics, one of the first questions that people ask, or the doctors usually ask, is, have you taken anabolic steroids? And if you're on testosterone replacement, that does class as it's the same sort of medication. So I think it's just a conversation that I have with people and understand that there have been links to having reduced fertility, certainly while you're on testosterone, and it's unclear whether there could be damage to someone's fertility later. So if you've got a young person in the sort of 30s, then sometimes that can prove a little bit tricky. And one of the things I sometimes will do is look at how we can boost that naturally. We can actually even take medication to, and I talked before about the brain telling the testicle.
Yeah.
So rather than trying to treat the testosterone side of increasing the level of testosterone, we try to increase the manufacture of testosterone by tricking the testicles into thinking that they need to produce it. So what we do is we use a medication that stimulates the brain to tell the testicles to make more testosterone.
Wow.
So that's one way of doing it. And then, but for most people most of my patients are usually in their 40s. They're usually pretty well informed about things, potential side effects of fertility and things. And generally, it's not particularly a major issue. Like I said, it's not a cut and dry thing. There's plenty of people out there. Loads of people use anabolic steroids and have kids.
Yeah.
Loads. So that's not really the case. It's not always a clear-cut case. If you want to replace the testosterone, which again, for someone like you, we decided that we had a lot. It's always a balancing up the benefits versus the risks.
Yep.
With you, we felt that the benefits far outweighed any risks. For us, the risk with you was we could reduce your own testosterone production. Well, in your case, your testosterone production was too low. So we opted to replace testosterone. And there's different ways you can give it. So there's a few options. The two ways I commonly do, I have two preferred methods. One is either and this is just sort of the less invasive one first. I don't have a preference. Both work very, very well. One way is to give a testosterone gel. I tend to have my own pharmacy that makes or compounds my own hormones. So I manufacture my own hormones. Mm-hmm. So I make a high strength compounded testosterone gel. It's stronger than the normal licensed preparations. It's more effective. It's bioidentical, so it resembles chemically. It's manufactured to chemically resemble or molecularly resemble your actual testosterone that you had. So it's not a synthetic version.
Right.
And it's what we call micronized. It's a micronized gel. So micronized gels basically pass through the skin very, very effectively. And they're also what we call liposomal. So that means that they like fat cells, so they go through the skin and they basically absorb into the fat cells. And the fat cells are a really good natural storage and releasing system for the testosterone. So they'll hold the testosterone and slow release it to the body, throw it over about 8 to 10 hours. So that's really very easy. So it's a gel, you put it on your wrist, rub it on your skin. So usually legs, inner thighs, outer thighs work really well. And patients can do that once, twice a day. Very, very few reported side effects. Generally very well tolerated. I think very handy if someone's traveling. We're going away a lot. I think the only downside of that is you've just got to put a gel on. You've got to remember to do it. And men particularly are worse than women at doing that for some reason. I don't know why. I mean, I think if you get into a routine, you're fine. But I think when you break routine, I think that's when it's difficult. So the gels work really, really well. Got to be careful because the gels are quite high strength. You don't want to put them on your palms.
Right.
Because especially if you've got small kids and you might pick your kids up. So within you don't want to apply gel and then start picking your kids up straight away. You need to leave it for a period, or potentially transferring it to your wife as well.
Yeah, so I don't think she'd appreciate that.
Yeah, exactly. You never know, people, I put a lot of women on testosterone replacement as well, but lower dose. Yeah. So generally the risks are really small.
I wouldn't want my wife lifting more than me. I wouldn't. No,
definitely not. So I think that's a really good way of doing it. The second way is injections. Oral testosterone doesn't work very well. It passes through the liver. It tends to affect the liver enzymes in quite a negative way. So we tend to avoid any sort of oral preparation of a tablet, for example. You can't just pop a pill for testosterone, which is a shame because it would work really well. But the other way is injections. And with injections, you've got different options. The one I tend to use, I like a certain type of testosterone that is a blend of a few different esters of testosterone. So there's different testosterone for injectable form can come in different what we call esters, okay? And these esters can vary so that some of them can be short acting, medium length acting, or long acting. So the one we use is a blend of 4 different esters, and we've got a mixture of short acting and long acting in there. But generally speaking, people will tend to need that injection at least once a week.
Right.
So they've got to inject. Now we tend to do that in the clinic. A lot of our patients come into the clinic, but some people will self-inject as well. They can be trained to do it. It's not a problem. The partners can do it as well for them if they're comfortable with that. The partner giving the injection is usually quite comfortable with it. It's the receiving party that's not always too happy about that.
I can understand
that. Quite nervous. Yeah. You see some people with horrified faces in the clinic when I sometimes suggest it. But there we go. The colour immediately drains out.
I can't imagine you trying to teach them to do that. That must be an awkward moment.
Yes, no, it can be done. But I think also it needs closer monitoring. Side effects, slightly higher profile side effects. People tend to get a little bit more water retention and blood pressures can come up a little bit on that. So we just got to keep an eye on that. But it's usually because we just need to find the perfect dose for them. Once you get the perfect dose, that works like a dream. There are other ways you can give long-acting injections. There is a product that you can give and you can inject that and it lasts 10 to 12 weeks. You tend to do it and then repeat it 6 to 8 weeks later. I have less experience with it. I've had some patients that have got it and done very well with it, but it's not my go-to staple. No. I'm probably 50% are on injections, 50% are on gels. And, we can swap. So we can swap in between. So sometimes if I've got someone who sort of travels or is away for 3 or 4 months of the year, they might be on injections for 9 months. And then when they go away, I put them on gels.
Makes sense.
If it's someone who doesn't live near me and whatever, then I might sometimes I'll usually find it's easier to do gels. And if they tolerate the gels really well and they're happy with it, then fine. It doesn't really matter. The gels are strong. People seem to think, the gels, you're not gonna get much in there, but they really do work because of the way they've been made.
Well, I can say definitely.
Yeah. So tell us how you're getting on.
Well, I think 4 weeks maybe?
Yeah. So early days.
Yeah, it's still quite early, but The only way I can describe it really, I mean, yes, my gym performance has gone up and things like that. So
that's one of the first things that people notice is the recovery.
Yeah.
The first improvement is, I've recovered much quicker.
It's just that feeling of feeling slightly stronger. And as you mentioned, the feeling of wanting to go to the gym again, that enjoying it and it not just feeling like a slog like it used to. Because I felt like I'd train and then I'd just be compiling it all week until I was absolutely just drained by the end of the week. But the interesting thing for me was, I think it was the beginning of last week, say Monday, I woke up and there was a feeling that I used to have all the time and it wasn't there. I can't articulate it any other way. It just wasn't there.
Yeah.
And I thought it was a bit odd. Thought I was getting on well. And then after a few days, I started to think, maybe this is what it's like to feel normal. And that's the only way I can describe it. I just feel better.
Yeah.
I just feel like, the brain fog's gone away, the low mood has gone away, and I just feel better. I don't know any other way of articulating it.
Yeah.
Really. But I mean...
Well, I'm excited to see your journey on it over the next 6 to 12 months, because I think, at this stage now, it's really good that you're seeing these sorts of improvements. And I think, we've got a long way to go really, where hopefully that's quite exciting for us, because I think that you're going to see some real benefits. We're hopeful of that.
Well, it's just, compared to how I felt, I mean, don't get me wrong, and obviously everybody has bad days, everyone has fatigue and all that sort of thing. I'm not expecting to feel like Superman all the time, but just, like that feeling of that brain fog, that just step behind that sort of feeling I had is not as prominent as it once was. But I mean, touching on the last thing I wanted to speak about was, obviously once I found out about testosterone, it encouraged me to read more about it and to find out as much as I could. And one of the things I read was a potential link between male suicide and testosterone. And it got me thinking, how many guys, unfortunately, haven't survived? And it was possible that they had low testosterone. I mean, we're speculating, obviously. We don't know.
Yeah, but it's it's very thought-provoking.
Yes.
It's a very valid point. I mean, look, one of the symptoms of testosterone is low mood and poor concentration, and those feeling of, lack of drive, lack of ambition, lack of energy. And they are all symptoms. They are all the same symptoms that you see in biological depression.
Yeah.
Okay? Not cognitive depression, biological depression. And so therefore, if that is the symptoms, then it's quite logical to suggest that low testosterone could be a contributing factor or one of the causing factors of self-harm or suicide. That's just a logical conclusion.
It has to be something that's worth investigating.
Yeah.
If you're a man or woman, I don't know.
Well, we're talking. I mean, look, it's really topical at the moment, isn't it? With men, we're a lot. We're seeing a lot now about male mental health.
Yeah.
Men are talking about mental health more now, which is a great thing. I mean, I've had two of my friends. I've got personal experience with that. One of my best friends, who was a dentist, my best friend from school, hung himself three or 4 years ago now. I've had other friends that have suffered with mental health problems, depression. We're seeing it all the time now. And I think there's a lot of problems. There's a lot of concerns about that. I mean, again, I think back to my friend. He went through a stage of, he was drinking a lot of alcohol. He had a very poor diet. He put a load of weight on. Was it that he was drinking alcohol? Was that causing it? Was it because he was overweight and he had bad gut health and that was causing
a brain? Feeling low and he was self-medicating?
Yeah. Was it that he had low testosterone? Probably a mixture of all of those things. What I would say to you, which I find, is if we look at some of the concerns I would have with seeing a lot of mental health problems, and we see a lot of it in people who seem to be on a surface very, very fit. Yeah, we see a lot of people who are very active gym goers and things like that. And I think I've always sort of thought about does we're seeing a lot of people, for example, using anabolic steroids a lot more now. And they're using them in uncontrolled manner, in an uncontrolled manner, and it's not being monitored, it's not being tested, and we don't know what they're using, and we know that, when you start to do this, that can cause, large surges in hormones, and that can cause a crash. And I've said this to you before, people ask me, will testosterone not make me moody? Well, no, because if I raise your levels of testosterone and I keep them stable, that won't cause a mood problem. What causes mood swings is yo-yoing levels. Yeah. So people who are using steroids, or if you've been on steroids and come off them, then these kind of fluctuations in hormones, that can have that can have impacts in mood. So yeah, I think there's two things. Low testosterone itself is potential for causing, depression.
Yeah.
And I think the use of anabolic steroids is making the matter even more complicated and possibly even worse. And I definitely think there's a link there.
Yeah.
Hopefully in time we'll be able to do more and more studies on that and look into that. But I think that's why it's important to talk about the importance of testosterone levels, full stop.
Yeah, and that's exactly why I got you on here. And, I'm really grateful for your time. You're a busy man, so I'm really grateful for that.
No, I always make time to talk about things like this. I think it's really important.
Yeah, and that's the vibe I got, hence me asking you. I mean, it wasn't easy to talk about this on camera. It's not something, again, men have a weird thing around testosterone. You mention it to your mates and they start saying, oh, I always knew you was a girl. And so, you get all the banter.
Yeah, I know. And well, this is the thing. And also some people feel like, I don't want people to know that I'm taking testosterone because they think that I'm, taking it to put, for some sort of cosmetic.
Yeah, another concern.
There's a stigma of using that, of using it for sort of the gym.
All I can say is that I felt really, really bad, and you've helped me with that. So I'm really grateful for that, and I'm really grateful for this.
Well, no, thank you very much for having me on.
Do you want to give your Instagram or social media stuff out for if anyone wants to follow you?
Yeah, please do. So we've got, I've got my clinic Instagram, which is, I think it's re_enhance. I think it is. That's the problem, because I don't do it. It'll come up. Right, so my clinic's, it's re-enhance.com. And you can follow on Instagram, Dr. Martin Kinsella.
Great.
That's my Instagram handle.
Nice. Thank you very much for that. And
my pleasure.
Thank you for watching, and tune in next week for another episode of the Strength Shed Sessions. Yeah. I'd like to take this opportunity to say thank you so much to Dr. Martin Kinsella for his time today. This was a tricky interview for me. I really wasn't sure whether I wanted to talk about this very personal issue I have with low testosterone on a public forum. But after giving it much thought and thinking about how I felt and how relieved I felt more than anything when I discovered that all of the way I had been feeling was due to having low testosterone, and that there was actually something I could do about it. After considering that and the potential links between low testosterone and male suicide, quite frankly, I felt an obligation to do this. And my hope is that anyone that's going through any of them symptoms or feeling in that way, look into it. It could be down to having low testosterone. It's actually more common than people think. And the difference it makes in somebody's life, in a man's life, and in turn women and whoever else is in that man's life, is huge. So I would really ask that people look into it. It's not always going to be low testosterone. There may or may not be other issues going on, but it's definitely something I would encourage people to look into. So thanks for watching the interview. I really appreciate it, and I hope that it helps in some way, or at least just opens your mind to other possibilities. Also, I'd like to take this opportunity to congratulate Martin and Hannah, his wife Hannah, on their pregnancy and their announcement in OK magazine. That's absolutely wonderful news, and I'm really, really happy for you both and wish you all the best. Thanks again for watching today. I really appreciate it. If you could subscribe to my YouTube channel, if you could follow my Instagram and like my Facebook page, that would be great. I'd really appreciate that. Thank you so much for watching, and I'll see you again on another episode of the Strength Shed Sessions.